Okay, good evening, everybody. I'd like to call the meeting of the Macon County Health Department Board to order on Tuesday, August 16th at 5:30 p.m. Before we have roll call, which we will do, but I'd like everybody to go around the room and introduce themselves. We have new board member Dr. Smith who's joining us tonight. So Mark Scranton, Board President.
Jeff Antler.
Debbie Hill.
Cody Parks.
Amy Wilcox.
Carolyn Wagner.
Dr. Brett Trigger.
Jan Hack.
Sharice Alenka, and I'm the Chief Financial Officer here at the Health Department.
Brady Binkley, and I'm the Public Health Administrator here. Nice to meet you.
Candy Clevenger.
Do you want staff to do?
Yes, absolutely, Kathy.
Kathy Wade, Director of Environmental Health and Emergency Preparedness.
Marissa Hosier, Director of Health Promotion and Public Relations.
Me.
Rachel Deerwester, Director of Clinical Nursing Services. So you go.
Susan.
Susan Hurdle, Assistant Administrator.
Bethany Staple Craig, I'm the Assistant Administrator here.
Mike Baggett, Assistant State's Attorney.
Teresa Smith, Director of Starting Point Senior Services.
Everybody? Okay, Susan, go ahead and do a roll call if you would.
Okay, Mark Scranton.
Here.
Jeff Antler.
Here.
Candy Clevenger.
Here.
Carolyn Wagner.
Here.
Jan Hack.
Here.
Debbie Hill.
Here.
Dr. Brett Jugger.
Here.
Dr. Mendigati. Cody Parks.
Here.
Dr. Smith.
Yes.
And Dr. Schneider.
Dr. Schneider. I knew we was missing somebody else. Okay. All right, if y'all would, please rise
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, get a motion to approve the agenda topics.
So moved. Second.
Who was first?
Jeff and Dr. Jurger.
Thank you.
Okay, roll call.
Mark Scranton.
Yes.
Jeff Antler.
Yes.
Candy Clevenger.
Yes.
Carolyn Wagner.
Yes.
Jan Hack.
Yes.
Debbie Hill. Dr. Jurger.
Yes.
Cody Parks.
Yes.
Dr. Smith.
Yes.
Okay, in your packet. We got the previous meeting minutes. You get a chance to review those for a minute and take a motion to approve those minutes as presented. If there's any changes.
Mark, just as a reminder, the closed minutes that are at the bottom, if we could do those now too, if the board feels comfortable.
We want to do that separately though, right?
We can, yeah, I just want to make sure
Okay,
that
yeah.
those are up there. Karen's also on there. Do you want to mention her too?
Okay, anybody got any questions on minutes from last month's meeting?
Are you still in the July meetings right now, Mark?
Yes.
Okay.
If not, I'll have a motion to approve those.
So moved.
Cody.
Second.
Mark
Who's first on
Scranton.
that?
Yes.
Jeff, thank you.
Jeff Antler.
Yes.
Candy Clevenger.
Yes.
Carolyn Wagner.
Yes.
Jan Hack.
Yeah.
Debbie Hill.
Yes.
Dr. Jurger.
Yes.
Cody Parks.
Yes.
Dr. Smith.
Yes.
And then a motion to approve the July 13th Finance Committee minutes.
So moved.
Second.
Mark, did you second?
Yes.
Okay.
Jeff and Mark.
Mark Scranton.
Yes.
Jeff Antler.
Yes.
Candy Clevenger.
Yes.
Carolyn Wagner.
Yes.
Jan Hack.
Yep.
Debbie Hill.
Yes.
Dr. Jurger.
Yes.
Dr. Smith.
Yes.
And Dr. Cody Parks.
Yes.
Okay, and then approval of the Finance Committee meeting minutes from August 1st meeting.
Motion approved.
Second.
Mark Scranton,
Yes.
Jeff Etler,
Yes.
Candy Clevenger,
Yes.
Carolyn Wagner,
Yes.
Jan Hack,
Yes.
Debbie Hill, Dr. Jerger,
Yes.
Cody Parks,
Yes.
Dr. Smith.
Yes.
Okay, that covers that. And then Brandy had asked if I would push up a approval of closed session meeting minutes from July 19th meeting. Mike, do you have any comments you want to make on that before we?
I do not, thank you.
Okay. So I'd request a motion to approve the closed session meeting minutes from July 19th as presented.
Second.
Dr. Jerger,
Mark Scranton,
Yes.
Jeff Etler,
Yes.
Candy Clevenger,
yes.
Carolyn Wagner,
Yes.
Jan Hack,
Yes.
Debbie Hill,
Yes.
Dr. Jerger,
Yes.
Cody Parks,
Yes.
Dr. Smith.
Yes.
That's 3/4 of our meeting right there.
There we go.
Literally, it's a whole lot of paper there. Okay, so, review of old business. I did have, a request from a couple board members to bring up the item from last month. And, we'll go through everything else first and we can visit that. Old business discussion action for Board of Health appointment, that has been completed based on applicants that were submitted to the county chairman and county board. And that's why Dr. Smith is now with us tonight. Review of the bylaws. I don't know if we have anything to update on that at all or not.
We do not at this time. I believe we're still waiting on me to complete a review. Additionally, before I think we have anything ready to submit to the board, we would want to include at least some members of the board in determining what needs to be changed, if anything, beyond what I might recommend.
Okay. Well, we have a bylaw committee, so
Who is that?
that they need to meet and review it. I mean, any board member can look through the bylaws if they have any questions or
Yeah,
things that they'd like to see changed.
I haven't gotten any yet, just so you know.
Okay.
Any feedback? Did you want to know who's on that committee?
Yeah, if you
I
would,
can
for the sake of the room.
It's changed a few times recently. Dr. Miniganti, Dr. Jerger, and then I believe,
Dr. Schneider.
that's what I thought, but yeah.
Dr. Schneider, you said?
Yes.
Okay. All right, update on Popeyes. Kathy, you got anything on that at all?
I do.
Okay, awesome.
So, it was, I believe, the 19th, I sent an email to Popeyes, the two gentlemen that were here, asking for clarification regarding the equipment. They're gonna use what's currently in there, if they're gonna get brand new equipment. Never heard back from them. 10 days later, I emailed again, saying, hey, I'm just circling back to touch base with you guys. That was on the 29th, and they did say that a lot of the littler equipment will be new. However, the walk-in, the freezer, once they finish the remodel, they will then check to see if that's going to be, if that will be working. I kind of think that's backwards. Before you do the remodel, let's make sure all of the big equipment's working, but that's how they want to do it. I also want to tell you that as of July 25th, one of the Popeyes in Springfield, their license was suspended by their health department. Basically identical to why we have suspended their licenses here. In some emails with what both Nick Freeman and Mr. Ali told Sangamon County, it's basically identical to what they've told you guys, and that they are going to make that store the training hub for Central Illinois for the Midwest. So they're in the process of getting that one. They have been reopened. They have done a lot of stuff, but a lot of what they've told you guys is what they have also told Sangamon County Health Department. I did drive by this morning. I do try and check out just to see how things are going. All of the big bushes and the landscaping have been torn out. The window that was broken has been replaced. The door is still plywood. I did see that they had power in the lobby. And one thing that was concerning, at 7:30 this morning, the back door was open. So I don't know what was going on. I don't know if they're doing that because of their maintenance workers. I really don't know at that point, but that's what I noticed this morning.
What is your thoughts on this? Because I had looked at some of I did a little bit of research on my own and looked at some reports from some of the other counties where they have operations at. I don't want to dismiss their efforts, but at the same time, what's your opinion about the reality of them actually doing what they say they're going to do? Should we just say, we think you guys are wasting your time here and just leave it at that, or do you want to give them the opportunity to show that they're going to do what they're going to do? Because they already started backpedaling from the very beginning, because when they came in here and convinced this board to give them the opportunity, they painted a pretty big picture with a very broad brush that they were going in there and making a substantial investment and replacing all the equipment and doing a lot of things. And now right out of the gate, you're saying, well, we're not going to do this, we're not going to do that. We looked at it again. They shouldn't have came to the meeting, in my opinion, and made the statements that they were going to do certain things if they weren't prepared to stand behind it. Now, part of maybe, supply chain issues. They said, we'd like to buy this new, but we can't get it for, 18 months. I mean, I'm looking at stuff in my business that's 6 months to a year out. It's not unusual when you talk to a lot of companies nowadays. What's your thoughts on that?
So going off of past experience with them, I think that I think there's going to be a lot of work ahead of us for my team. You guys have already given them the approval to go. At this point, I don't feel that they've done anything that warrants us to backtrack, because they really haven't proved or disproved anything at this point. I will, if I can, I'd like to read you a little bit of what Sangamon County did, just so you know that this was their 9th re-inspection. So they had staff out there 8 previous times before they actually
Over
closed
what
them.
time period?
I don't know. 9th re-inspected of 2022 is what it says. So they've been out there 9 times for a re-inspection this year alone.
That's like one a month.
How many before COVID actually started?
I'm sorry?
How many before COVID actually, it seems like a lot of these places are having problems after COVID, all restrictions, nobody.
So, I'd love to be able to show you this, because I'm having, this is how Sangamon County does theirs. So it does show you like the number of routine inspections. That gold color is all re-inspections. And I think the peachy color, which is only 2 on this, are routine inspections. Everything else has been re-inspections. And I don't know without really looking at it.
Was it the same on the temps or?
Oh yeah, they're all pretty much identical.
The one here was closed before COVID ever
Yeah.
happened, right? So
Yeah,
This is
yeah.
a problem, at least for the local one.
Well, and I will tell you that from what I did, the research that I gave you guys for the month that they did come to talk to you guys, that was accumulation over a couple years that was prior to COVID too, and they were still having the same problems before COVID. I think what COVID is doing now is that we've got a lot of short staff.
Right.
So you're just not getting the staff to be able to work it. I think the food portion of it, from what we're hearing, that's kind of equaling it out now. It's not as bad as it used to be. Equipment is definitely still on hold. It could take 9 to 12 to 18 months on some stuff. But the biggest issue right now is the staff. You just can't get the staff to work.
I think at this point, if we just, they have to prove what they said. If they said they was gonna do something, if they
Yeah,
follow the rules, they
came in
said.
and convinced us
I mean,
that
at
they
this
were
point,
gonna
they
do a lot.
haven't even started it. They just started last week doing anything there, and they was there this morning working, so, I mean.
They've been there for a couple of previous to that, because I met with them last month up there.
So I would say, I'm saying as far as actually starting, he started last week turning out bushes and stuff, so I mean, I'd just say, here's what you said here in the meeting, here's what you're gonna do, or, I mean, we got the power of the pen, they don't have to open it up. They can do the whole remodel, and after the very last remodel, the place is all fixed up, they don't have to open it, they don't do what they said.
The refrigeration is what bothers me.
It's a big concern for me.
How long has that been shut down?
And they said they were getting all new
2019?
refrigeration.
18, 19? I don't remember what
Because
year
it was
off the top
closed
of
for
my
a while,
head.
then they reopened, and it wasn't open very long and closed again.
I think it was 2006.
We're talking at least 3 years,
Yep.
that equipment's been sitting there.
Has it been that long?
Oh, yeah, at least.
Yeah.
Because they closed long before COVID.
Oh, they did.
They closed.
Oh, yeah, they
closed in
were
19.
done prior to
They
COVID.
they closed down at 19, and that was the second time they closed down, because they'd only been back open for not a very long period of time.
But when
It
you
seemed
got
like
chicken and it's hot and cold,
the power's been shut off the building, so.
previous.
Well, Kathy, I would appreciate if you could give us an update again on that next month and kind of keep us surprised, because I think the board would like to support any business that is making a genuine effort, but what they told us they were gonna do and some of the things they've already kind of backed off on, so kind of changing, it's disheartening to hear that they're having such a poor record in the neighboring county. Because, I mean, that's the one thing that they came in, for those of you that are new to the board, they came in and painted a pretty big picture of their operation. They've got 400 restaurants collectively that this corporation owns and operates under. It's not all just Popeyes, they've got Taco Bell and other ones too. I don't remember what all they have, but they got a pretty extensive base of operations. And like any big company, you're always gonna have issues, but they came in here, was the vice president, wasn't it, of their operations, another gentleman came in, and they basically sold us on the idea that they were gonna revamp that store top to bottom, replace all the equipment, gonna become a training center, reinvest back in the community and stuff. So I mean, they came in and told a good story. I just hope they make that effort to bring that to fruition, so.
Can the board send him a letter
I
that
don't,
says you got, at this point, say that you guys, you came in, you promised this, we've been watching it, and at this point, we don't see that happening, we just wanted to see what your plan was and just have it come from the board to them? Is that
I don't
something we
think
cannot do?
they haven't even started the inside stuff at all, though, I don't think they ever, I mean, to give them a letter right now, I would give them, once they start the remodel, that's when I would attack them, because, I mean,
Sounds
they
good.
literally haven't done that besides fix, there was one window broken, one door, and that was from the community, somebody broke it, they didn't.
Okay.
They fixed that, or the lights have been on that place for 3 years, the lights never been on, they're on every night,
Really?
inside and outside, yeah.
Could we request that they visit us again,
Oh, yeah.
like in 2 months, and give us a progress
I
report?
think that would be
And
good.
then we
That's
can put it
good.
on the
Is that
record.
coming from the board or from me?
I would say you could send them a letter saying the board's requested you to come in and provide us an update at 90 days.
Yeah.
And then put them on the calendar for, let's see, we're August.
because he
September.
said it was gonna take 9 months.
They said 9 to 12
Yeah.
We'd
months.
still
Like
like to hear
October-ish,
progress.
You know, October-ish, give us a,
October,
yeah, we'd like
November.
you to come down, and we want the man from Bolingbrook.
Every 60 days, they can give some sort of update.
Well, he
He's
is
the one
the
that came in
gentleman
and
who
convinced us of it.
is in charge, so.
It's in their best interest to keep us updated.
It
like
surely
stay-
is,
Stay,
yes.
good
Yes.
communication with us and stuff, so.
You want me to email them?
Yeah, and then Brandy copied me on that too as well, when you guys send that. But I mean, I'm good if we give them 60, 90 days down the road. I'd like to get them in front of us before the end of the year again at some point. So based on everybody's availability, I think that would be beneficial.
Okay.
That way Kathy's not having to deal with it on her own, and they can hear from the board whether they're encouraged by their progress or not. that'll kind of,
I was kind of impressed, I did talk to the landscaper that was there working, and while he was there working, he was dealing with, I don't know if he's dealing with the guy from Bolingbrook, but there was one of the managers there, gave him the job, and prepaid him before he started the job, actually wrote him a check, and it was a sizable amount, and said, here, you're prepaid, do the work. So, that
well,
was,
that's good.
that was a roughly a $15,000 job. that he
Well,
prepaid.
anytime you get a project started, it takes a little bit
Oh,
to
yeah.
get
No, it's right.
things off the ground,
Yeah.
Well,
so.
why are they working outside, and not inside?
Well,
A lot of it was so built up that, I mean, the one portion, by Pershing, you couldn't even see that
Oh,
there was
yeah, it's
spotlights
totally grown
behind it
over.
because there was
You couldn't
so
see the
much
building
camera
from the road.
And the landscaper also did say that the manager had reached out to him 3 times for 2 months. And he didn't respond because when he seen the out-of-town number and the out-of-town request, he didn't want to deal with it because usually you don't get paid.
Yeah,
And the third time they requested, they said, hey, nobody else has responded. He responded to 3 customers or 3 contractors in Decatur. No one got back with him. Besides this one guy, he got the job, he got prepaid. So that's a good sign.
I don't think so.
So, like I said, he didn't make that step. I mean, it does look good there now. At least it don't look like a jungle, So,
okay, all right, thanks, guys. Okay, update on resolutions present July meeting.
That's a quick update. All of the resolutions passed that we discussed last month. So that included the postage, the electronic medical records, and also the digital environmental health. It's gone through all the steps and we're getting everything signed now. And to follow up about the electronic medical records, that Mike was going to ensure that the language on everything matched up and was good to go. He did help with all of that and we got that through the full county board. So I just wanted you all to know the good news. That's it.
Yeah. Okay, last thing on their old business to revisit again, I had a couple people reach out and ask if we would bring up a discussion about mask optional for meetings, so open that back up, whoever wanted to bring that up, talk about it, decide if it's something we want to take action on tonight or not.
I'm sorry, Mr. President, I don't actually see that on tonight's agenda.
Okay,
And of course, that doesn't prevent you from discussing it, but I think it would prevent you from taking any action.
okay. Well, that's what I was asking for, was discussion, so I appreciate the note on that. So if anybody's got anything they want to convey, now's the time to do it, and if we choose to do so, we can put it on the agenda for next month's meeting.
Well, I did not approach Mark about the masks, so and we talk on a regular basis, but I'll just broach the subject. I'm just kind of curious if that is a possibility to be mask optional, like we're seeing at the federal and the state level, that for certain areas, the masks are the mask usage is being minimized, and we're in I know we've heard a lot of your discussions about why they're needed here, but might that be possible for this meeting to be
Well, I just,
mask optional? People that want to wear masks, wear them.
the CDC's
No
even
questions
lowered
asked.
guidelines even now, just this week even.
Do you have to wear them at the county building?
No,
No,
not at all.
they're not worn at the hospital on the administrative floor,
You don't?
nobody. If you're in a clinical patient area, they're worn. But on the hospital administrative area, nobody wears masks. And I don't wear them in my office. My own personal philosophy and investigation into it is that unless we're all wearing N95s,
Yes.
it's a charade.
Yes.
That's my thought. There's no good data on anything but N95s. Either then they're not completely safe, so.
You need 2 N95s to get higher in the curve, is that?
I mean, you can't.
I don't even think they.
We can't.
I don't know, when we were operating on patients with COVID during the bad times, it was really hard to breathe wearing an N95 in a surgical suite. And, if I had to do a procedure that was longer than an hour, it was tough. I was almost tempted to just take a break and go out and breathe some fresh air before I went back in, because breathing through them is difficult. But, there's science to say that they're a little safer than, her mask versus your mask versus, there's no scientific data to suggest that one's better than another. In fact, some of the data read suggested that cloth masks are worse than no mask.
They get wet.
I can tell you, I wear N95 mask for over 30 years because of my business. I'm around a lot of dust, some of it which is considered to be hazardous. And there's nothing worse than trying to have a mask on working in 100-degree heat. But you gotta do it because you got all this airborne dust and you gotta try to block it out. And even when you do that, you take your mask off and you got this big ring around your face. You really get down to it, if you really want to eliminate any kind of intake of anything at all, regardless of whether it's dust or whatever, the only thing you gotta do, everybody at work wears positive pressure, either mask or hoods, because you've got to push the stuff away from your face, because you create, just people understand airflows, but you're creating a negative air environment when you put any kind of mask on, even an N95, because it's not form-fitting. Go around the room, I've got facial hair on, an N95 mask will not fit me as good as like Dr. Jerger, for example, who's clean shaven. I was on fire department for 14 years. I can tell you, you did testing with SCBA's because OSHA guidelines mandated, and you do ampule test with things to check and see if you got a positive fit, even on a positive air supplied respirator even. So you're never going to eliminate it completely, but yeah, like you said, there's some masks that are more effective than others. But I can tell you, we had a case of N95 masks in the shop, and within a week they were gone, and we couldn't even find them. So it made it really, really tough because that was the normal part of our business. So we really struggled as a business to even have the basic tools we needed to work safely on a daily basis. So,
Maybe we can vote on it or something.
we'd have to put, like Mike said, we'd have to put it on the agenda to vote, to be able to vote on it.
I would like to just add that I was researching, trying to look into the OSHA, that you brought that concern up with regards to their requirements. From best I could see, they put this out in July of 21. And I could not find anything that was updated, but I did find from a law review article regarding OSHA law that they talked about what to do with administrative people who were not actually seeing patients. And that clinics such as this would be deemed different than, say, ambulatory care who's seeing urgent sick people coming in. This is more a well clinic versus a sick clinic. And the fact that this room is, as you said, occasionally used for overflow with immunizations. And I'm not an attorney, and I'm not an attorney certainly in this type of law, but just using rational thinking, this is after hours, it is closed, there are no patients here. We are all being screened with our temperature before we come in here. We are all being asked to stay away if we are ill or have been ill. We are sitting apart, not exactly 6 feet, but we're sitting apart. Personally, I don't, from what I've read, believe we would be in violation of OSHA. And we are not employees. So your board members are not employees. So to me, I don't think that OSHA necessarily covers us in that setting. So that's just my input from having spent some time surfing the web and looking at it. Anything different that you've been told, or?
I know that we kind of just, lightly brushed on it last month, that it's not just OSHA. So I'm still sticking to the point of, I would really like to get an opinion from Mike Baggett. Maybe a review, and Mike, I don't know if you've had a chance to do that at all, if you haven't, necessarily been specifically asked to do it, but I do think that would be helpful maybe for me and the entire board, to move the whole building forward, because my top priority in this building has been to keep everybody safe. And so, and that's not just safe as far as COVID, but safe as far as not presenting extra liability or risk to the health department or county. So when there were things like OSHA, when it talked about if you even let someone symptomatic come in your building, then you have to have this other huge plan, then that applied to people who weren't necessarily employees. So I think it might be helpful for all of us if Mike could kind of research what all we're subject to because of being a healthcare facility and be able to give us an opinion on what could be changed with masking and when, and then maybe you would feel more like you have what you need to make that vote if you choose to do it, because I do feel very strongly that I don't think we should be presenting liability. I think we've strived very hard since the beginning of the pandemic and even before it hit here to keep everyone as safe as possible and limit that risk and liability in all the different ways. So I just want to make sure that we're continuing to do that. Not just for board, but for my staff too, because we all don't want to wear masks forever, right? It's not a forever thing, but when can we make those adjustments? So I think that'd be helpful, Mike, if that's something you could help with.
That's the problem, because nobody's going out on the limb and making those judgments. So I think the plan that you have of asking Mike to review the websites that I spoke about, that you know about, because I think it's gonna have to be a concerted, educated opinion.
Okay, well, if I can clarify my brief here, Randy, you may have gotten a little bit further into the weeds than I originally understood the question. So I just want to clarify what the desire of the board is in terms of seeking an opinion on potential change. I understood it at the beginning to be whether there was any liability from a regulatory or an exposure to litigation liability if the Board of Health were to lift the mask mandate during these Board of Health meetings. Is it broader than that? Are we talking about lifting the mandate in the building during regular work days amongst patients in administrative areas of the department? Or are we just looking at the people in this room for the purposes of this meeting not having to wear a mask when they're in the building?
So I would like to request that it be for the building overall and for staff, because of the fact that if our staff know the board doesn't have to wear a mask and they're in the building, then obviously I'm gonna get questions about, I mean, people have been really great with, being compliant, following the rules, stuff like that, but people are gonna ask questions. If the board doesn't have to wear a mask, do they have to wear a mask? And I think the more prepared I can be to know when and where we can make those changes, the more comfortable I will feel too, because I don't want to have an employee, human resources or litigation issue because their coworker got close to them and wasn't wearing a mask and then they made them sick or something like that, because that could be a problem for all of us. So I would like to respectfully request that we have that for the building overall. And I think, did you want to say something, Rachel?
Yeah.
She's our director of clinical nursing, just so you know, I think she wants to say something.
I've been sitting on all of the IDPH and CDC calls with the recent updates that they've made, so food for thought. The executive order that involves masking actually is up for renewal / possibly ending on August the 20th, so in a few days. And CDC has also stated that along with their updated guidance for general population, K through 12, they are looking at updating healthcare guidance as well. We anticipate that that's going to come out around that time. So it might be worth coming back to this when that healthcare guidance is updated, because if that healthcare guidance is updated and the masking is eliminated, that's the category we have followed this entire time. So that might give you a little bit more, just something else to go on for an opinion and for making a decision.
And when is that expected to come out?
I'm not entirely sure, but as soon as I find out, I can certainly, give the word to let you know. I expect it to be around that August 20th, but CDC versus an Illinois state statute, so you know what I mean? I don't know, I'm not sure, but I expect it to be soon, probably prior to your next board meeting.
Well, the CDC just came out just in the last, week or so?
Yes, those are the
Changed
meetings that I've
guidelines
been
about
on, right, and so they said healthcare is
quarantine
next.
and all this, all of a sudden,
Yeah.
it's like,
And as far as an enforcement arm, OSHA is really, am I correct? The one that we need to be concerned about.
Well, I think also CMS, I mean, those are at least a couple off the top of my head. I know that there are certain rules that if you build a CMS that you're required to follow. OSHA's been a huge one just because they did put all of that information out, all these requirements and a plan you had to follow. It was very, very extensive, so that was a big one. And then like Rachel said, we have really been following the healthcare guidance specifically just because we are a very diverse building where we don't just do, clinical, or we don't just have one area and people don't kind of stay put in just one area. So we more stayed on the side of being stricter with the healthcare guidance as to not present unnecessary, liability or issues. So that's why I would feel a lot more comfortable making some of those changes with having some legal input.
Do you guys wear yours all day during the day in your office?
So if you're in your own office by yourself, you can have your mask off. If you're in any of the common areas, you have to have a mask on. If you're gonna be in an open area, like we've got areas where clerical people sit and they are distanced, but they're in that open area, so they have to have their masks on. Going to the bathroom, you have to have your mask on. We've limited in-person meetings, but when we have them, we distance and we have our masks on. When we attend meetings, we wear our masks. So that kind of helps give you an idea.
The inspectors wear them out.
The inspectors wear them out. Home visitors who are going into people's homes, sometimes senior citizens' homes, that may be immunocompromised, they're wearing them. Anytime we would get within that 6 feet of a client or patient, so, dental or doing a vaccination or just giving somebody, their money with the money management program, any of that kind of stuff, they'd have their mask on, as to not, again, present that extra risk either way, so. And that's another thing we've looked at as we've talked about making changes in the building for staff is there may end up being different rules for if someone's in a clinical setting or in somebody's home or something versus if you're just in administration, having a group meeting or something like that. So I think, again, though, if you're not doing it all consistently across the board, you just want to be careful because you may end up having some employee complaints or concerns, and I just want to make sure we're kind of, crossing every T to protect the health department as much as possible in every way.
So one thing you talked about, just for everyone's information, you said, it could end up being 2 different levels like you're saying. But when was the last time this room was truly used for clinical patients?
Last week.
And so, and say, you were saying, I think before, maybe once every 2 or 3 weeks that this room gets used for clinical?
It just depends on how busy we are and what our flow is. It's actually going to be getting used more because we are going to be getting our student nursing back. So we'll be able to expand our clinic opportunities and student nurses will be able to socially distance and vaccinate in this room. So here in a couple of weeks, it'll be getting used a lot more frequently than it has been throughout the summer.
But you guys are getting everything cleaned
Yeah.
on a daily basis, right?
Oh, yes, we definitely clean and disinfect between every
Done,
patient.
the room's cleaned, right? Just like they would be at my office or anyone
Sterile.
else's.
If the
office,
building
right?
commission handles that.
Okay. Anybody got anything else on this? Okay. All right, thanks for everybody's input on that. And, okay, before we do new business, getting into the budget, Randy had asked me to let the division report presentation be done for HR, so do that right now.
Bethany's gonna present to you for this.
All right, good evening. So for those of you that don't know, I'm Bethany and I'm the Assistant Public Health Administrator here at the Health Department. Just a little background, I do have a master's degree in public health and I have over 10 years of public health experience while also having a public health administrator certification. So some of my responsibilities in this role are assisting and backing up Brandy and all of the other directors throughout the building. So that's anything from personnel, fiscal, administration, public relations, human resources, employee relations, and so forth. So it's a constant task to stay up to date on employee files as employees come on board and leave, along with ensuring staff stay compliant with all the trainings. We continually try to update our processes to make them as effective and as accurate as possible, like implementing our MIP software that allows us to include some of our HR functions for tracking purposes. So typically, we fluctuate at about 80 to 90 employees, and our building is staffed from 7 a.m. to 4:30, plus depending on what's going on, then we've got some nights and weekends thrown in there. We also do have an on-call system, so our team, they do receive calls from, whether it's the hospitals or IDPH, doctor's offices, that kind of thing at all hours, and even sometimes in the middle of the night, depending on what the situation might be. So there's lots of behind the scenes that myself and the team work together on, whether that's job postings or hiring, post-job offer screenings, contingent offers, final offers, onboarding new employees, reviewing job descriptions at least annually, employee performance evaluations, and all of those sorts of things. So the employee performance evaluations, that was brought up at a recent meeting, and so Mark had asked me if I would explain that process a little bit to all of you. So I'll take the opportunity to shed a little light on that process, but without taking up too much of your time. But it is also outlined in the personnel manual if you ever want to reference it there as well. All right, so these are merit-based performance evaluations, and staff can receive up to a certain amount. I think Carolyn had asked about that, and so we talked about that a little bit at the last meeting. But staff that haven't been here at least a year, they would only be eligible for that prorated rate. And this was developed years ago, so then new employees wouldn't come in making more than someone who's been here longer. So like I said, those job descriptions are reviewed by the division directors and assistant directors each year, along with HR helping in that process. The performance evaluations are given to the staff to complete their portion, and then it's returned to the director and the assistant director for them to complete their portion. The evaluations are then reviewed and completed together by the director, the assistant director, and the employee. So in the evaluation, we establish SMART goals for the coming year. That would be, specific, measurable, attainable, relevant, timely, inclusive, and equitable goals. And from my experience, this process, it does seem pretty similar across other local health departments. And as you know, most of our staff, they do understand the process goes through many boards and approvals. So once the county board budget would be approved, then they would sign the form that is used by the county auditor's office if they were awarded that raise. A lot of paperwork is completed in a short period of time to get everyone everything that they need. And so that evaluation process with the employee, it is done simultaneously with the budget potential raise votes. However, yes, we can only go up to whatever the board would approve. So along with the evaluations, as I said at the finance committee meeting, I do continually try to gather salary information of other local health departments and other comparable organizations. We want to try to invest in our workforce if and when we can to keep them all here because turnover is high. And while training is incredibly important, it does take a considerable amount of time for someone to train a new employee. And I also serve as kind of a liaison between the employees through all the divisions and possibly their supervisors in the county office to report any employee accidents, non-employee accidents, IMRF short-term disability, benefit or insurance information, and I work with any employees and help coordinate things if they would need to be on any type of family medical leave or anything like that. So I couldn't do it though without, all of the directors and the admin team that helps make all of that come together and possible. So I think that kind of briefly sums it up. A lot of it's probably pretty straightforward for some of you that are familiar with all that, but do you have any questions?
Do you have any assistants in the HR department that work with you?
Yeah, so I work very closely with all of the admin team, but they also have, Board of Health Management or fines, helping with supplies, purchasing, all of that. So there's, not like one that's necessarily specifically devoted to only HR functions. Oh. Everybody wears like lots of hats here that, lots of things going on and kind of covering many things with that.
Okay, thanks, Bethany.
Thank you.
Real quickly before we get to the next item on the agenda, I was remiss earlier because I did this once, so I kind of forgot to do it again. For the sake of the rest of the board that was not here for the finance committee meeting, Tammy Wilcox sitting down here at the end of the table. She's our new Macon County administrator. And she had asked about coming to the meeting. I said she's more than welcome to come and sit down and learn a little bit about what we're doing and how we do it. So thanks again, Tammy, for coming tonight and kind of shadowing what we're doing.
It helps me.
Yes, absolutely. She's got a lot of responsibility. So I think she's a great asset to the county now. Great addition. Okay, moving on, we will get into discussing of the proposed budget. Just to preface this before we get into this and let Sharice and Brandy do their thing on this. So the finance committee, which consists of myself, Jeff, and Candy, we've had multiple meetings with the administrative staff and CFO, going over things pertaining to the budget, where we've been, where we're at, and where we're headed. And so I think they put together a good budget based on our last meeting we had a couple weeks ago, with some recommendations we made and some changes we made, and both on the budget itself overall and also on where we're at with evaluations on how to make adjustments on pay grades. Traditionally, the board has always done a flat percentage across the board. There was a lot of conversations back and forth about how to do that going forward. And what we arrived at was a multi-tiered level for raise increases. And when those are done, that basically gives Brandy the authority as she does evaluations and the rest of her team do evaluations on staff. It gives a cap for them to give people a raise up to a certain level. So we kind of took a different approach to this to kind of bring up the lower level people up more so, because a lot of these positions, as you look at the pay grades, when we get done going through the budget part of this, you'll see that a lot of people are making about what they make for what to go with Walmart and McDonald's. So as a struggle for staff to try to maintain staff, it's important, I think, that we get these people in some of these lower paying positions, you know, the ability to know that they're being invested in, and try to keep them to remain to be a viable part of the organization. So I just wanted to kind of let you know what work that the finance committee's done in the background on this, because we spent quite a bit of time on it, both in meetings and outside of meetings as well. And I think we've got ourselves in a good place. I think Sharice's done a great job going back and revising the budget, and has got us in a good place in a number of ways. And with that being said, I'll let you have the floor.
Okay, so there's a couple documents in your packet. The first one starts out with the heading totals FY23 proposed budget, December 1st, 2022 through November 30th, 23. So this is our FY23 budget that begins December 1st. So this document will give you line item totals by each revenue account and expense account, broken down by direct and indirect expenses throughout the entire health department. And then the next set of documents that you see with the heading Macon County FY 2023 budget process, these are the forms provided to us by the county auditor's office, and they are broken down by department. So just to kind of summarize what all is in this budget, like Mark mentioned, the raises, we took the recommendation of the finance committee where levels 1 through 8 can receive up to a 5% raise. And that is our clerical up to professional level staff. Professional level staff would include our nurses, case managers, those types of employees. Then levels 9 through 11, which is supervisory staff, can receive up to 2.5% raise. And then level 12 and 13 can receive up to 1.5% raise. So those are the raise caps included in the budget. Also, let's see. There's lots of different directions I can go. So this budget shows an average monthly expenditure of around $602,000. So we always kind of look at that so we can calculate what our fund balance should be. So we would have a balance in the bank so we could continue to operate if something happens, such as the state stops paying or something like that. So 4 months of that would be 2.4 million. Our health fund balance right now is at 7.5 million. So that is like, you want to think of that as like our savings account, more or less. So every year, if we have a surplus or a deficit, it either rolls up into the fund balance or it's taken from the fund balance. Indirect overhead administrative costs are 20% of the budget, and personnel and fringe is 78%. Okay, So bottom line, this budget brings us down to negative 112,000. As I've mentioned in several of the meetings already, we never want our bottom line to be negative. It almost never ends up negative. It's very rare that we would spend as much as we have in the budget. As you know, our staffing fluctuates a lot. We have a lot of people coming and going throughout the year. So the budget includes every position fully staffed the entire year, except I did go through and a few of the positions that are vacant right now, I knocked down to only 23 pay periods instead of 26 to kind of give us a little bit more of a realistic picture. Although honestly, it'll probably be more than that. So we're at negative 112. Then we also have a couple of grants that we have applied for that we will likely be receiving additional funding. HIV project, which would be part of the comprehensive health protection grant. So that would be an additional $15,000 in revenue. And we have applied for a Delta dental grant, which would be an additional $86,000 in revenue. So if we receive those, it would bring our projected bottom line down to only negative 11,000. Looking at the budget overall, I always kind of try to see where we are seeing a major change from last year and what I'm projecting next year. The major issue in this budget for that is security expense. We are paying sheriff deputies right now time and a half to be in the building all the time. So that is a significant expense. And Mark and Jeff have been in communication with the county sheriff, trying to work on that a little bit, and Randy also. So hopefully that expense won't have to be as high as it is in the end, but that's what I have in there for now. Other than that, I'm not going to go through it line by line unless someone has specific questions.
I got a question.
Yes.
Why time and a half? Why not just regular time?
Because on higher back, they have to do that per their union contract agreement. The Decatur Police and Macon County Sheriff both have that on their higher back, doing work outside of their normal scope of their job. So we're literally hiring them back. They're not working on behalf of the sheriff's office in an active role during the time that they're doing it. So that's why we're paying the extra money out for that.
Additionally, Mr. President, you have a situation with sheriff's deputies where they're employed by the same employer. So under the Federal Labor Standards Act, any time that they work over their 40 hours would be time and a half because they're all Macon County employees.
And we've looked at, just so you know, we've looked at some different options. I talked to Sheriff Root about it. We had thought we had a good idea until I talked to him and he literally shot it down. We were talking about hiring potentially retirees or some other people that have law enforcement background, but he said they have no police powers as given by state statute. So if they got in a situation where they had to take some kind of action, they would have to bring in outside help. So they cannot carry, even though they could be a licensed concealed carry holder, they can't actively carry a firearm as a retired law enforcement in this particular scenario. They don't have any police power as far as making an arrest or anything like that. So he said you're basically paying for a really, really expensive security guard if that's the direction that you want to go. Those are some restrictions that are put in place, and that's why we have to really go this other direction. But we're talking to them about there's a way it could be formatted, and maybe we could do something to reduce the cost either in hours that they work or the structure of how it's done. Because he said you could have a senior deputy apply for this position, and you're going to pay a higher level based on what his salary is at the time versus somebody that's relatively new, because they put these out and guys basically bid on based on their availability or their interest or whatever. So, but this is something they have to do. I think they do the same thing like the Civic Center, for example. And I don't know about the Transit Authority or not. They have similar type.
I mean, but yeah, you're dealing with both union considerations because we're contracting with the department. And with the sheriff's office, it's more of a memorandum of understanding as opposed to a contract per se, but you're still contracting with the department, and the department has to follow their union contract, which gives them imposes on them obligations to let it for bid based on seniority, which is exactly what Mark was describing.
So we're working on that. Hopefully we can make that a little bit better, but it is a absolutely necessary expense that we have here to make sure everybody's protected. That's one of the first things when I got on the board and took a tour of Brandy. I said, what do we do about getting the locks put on the doors, electronic locks to secure the building? I'm a big believer in being very proactive. There's way too many active shooter situations coming out there, and just criminal people, and staff is dealing with some people that are not necessarily in the best part of their lives in certain situations. When they come in here needing services, they may not be happy. I know Kathy's had issues in the past with some disgruntled business people that have not been really receptive to their staff. They've had to get some assistance from law enforcement. So we want to make sure we take care of people here, and that's a paramount issue for me. And we've gotten that done. We're making progress, so that's great. Okay, so anybody else have any questions on the budget? I will just let you know that, like I said, we met and went through this. We had a meeting prior to this meeting now, and the three of us all voted in favor of supporting this budget as it was presented to the board tonight for consideration. So I would just let you know that we've done our due diligence, and we feel good about where we're at this point with the budget as it's been presented. So anybody else got any questions for Randy or Sharice at all?
I will say, just so I can say it here to all of you, since you weren't all in the finance committee meetings, I do feel strongly about not giving a tiered system. I do think that our supervisory staff, at least levels 9 through 11, should be eligible to receive the same percentage of raise as level 1s through 8. Those staff, it's explained to me that it was a lower percentage presented because they already make more, but they make more because some of them have been here a very long time. And then of course in a supervisory role, as many of you know, you're managing people, you're on call more than other staff are, you have a higher level of responsibility. And so I do have concerns about making them eligible to get a lower percentage of raise just simply because they already make more. I think that could possibly negatively impact morale and productivity. And we've already seen it in the budget numbers that it is causing pay compression, which if you've been on the board for a while, we've been talking about pay compression concerns for years when it came to increase of minimum wage. So I do just want to go on record. I have requested the finance committee, and I request all of you, if we can't do it this year, to very strongly consider making our supervisory staff eligible for the same percentage, because we do have a healthy fund balance of $7.5 million. So when you see that, what it looks like a minus, that just means it's coming from our health fund. The health department's fiscal management has been extremely responsible for many years, or we wouldn't have $7.5 million. And I feel as if a way to invest that money, in addition to some of the things we're already doing, like electronic medical records, digital environmental health, and security, I feel that especially in a nationwide staffing crisis, that we should invest in our staff, the ones that are already here, especially those who have been willing to take on more duties, and then also those that we're trying to recruit. So I do ask, if the board will not approve that this year, that we can continue the conversation. I've asked the finance committee to do that with me as well, of how we can continue to bring everyone up and not make anybody feel like they're being shorted simply because they make more.
And
Go ahead.
I wasn't saying, I might add that, while, those professional levels 1 through 7, we do want to bring those up. Those are positions that, they tend to be not as high a turnover, and we're able to fill those where levels 8 and up are our hardest positions to fill. That's where we have the most vacancies, are those levels 8 and up, the supervisory responsibilities that come with some of those positions. So like Randy said, if it's something that we, if we're saying that we can't afford this right now, definitely looking at the future, because that pay compression is very real. And now we're in a situation where some of those, like where the 5% is, they're gonna be making more than people in the supervisor role. So, just looking at that, how we can move forward, because like Greg said, employee morale and turnover with that, so, it's less expensive for us to be able to address those pay inequities now upfront, instead of continuing to lose some of our, best talent or, most qualified that they can go elsewhere, because it is those 8 and up that have opportunities elsewhere, and can get paid more with different benefits, other benefits and that kind of thing. So, something if we can control it, especially as we move forward, how we look at that.
Okay, anybody got anything else? Okay, I'd like to get a motion to approve the FY 2023 budget as presented.
Second.
Roll call.
Candy?
Thank you. Mark Scranton,
Yes.
Jeff Entler,
Yes.
Candy Clevenger.
Yes.
Carolyn Wagner,
Yes.
Jan Hack.
Yes.
Debbie Hill,
Yes.
Dr. Jerker,
Yes.
Cody Parks,
Yes.
Dr. Smith.
Yes.
Okay,
I just want to add, as the next step, we will present this to the county finance committee on September 12th.
so everything we do tonight is subject to them approving it and then it's subject to the county board approving it. So there's multiple steps there. Thank you for bringing that up. Okay, motion for approval of the FY 2023 pay grade scale.
So moved.
And motion is made and second. Roll call.
Mark Scranton,
Yes.
Jeff Entler,
Yes.
Candy Clevenger, Carolyn Wagner,
Yes.
Jan Hack.
Yes.
Debbie Hill, Dr. Jerker,
Yes.
Cody Parks,
Yes.
Dr. Smith.
Yes.
Okay, let's see. Your board education, communicable disease update, Brandy.
Just a quick thing, I know I usually do COVID updates in here, but I felt like now would be a good time to, kind of adjust to ensuring that we are addressing, MPV or monkeypox. So I just want to make sure you all knew, in case you were getting questions, we do not yet have a positive confirmed case in Macon County, and also do not have vaccine. We will not receive vaccine here until we have a positive case. If and when we have a positive case, then obviously information will go out about that. And then COVID update, we are in medium community level and we are in high community transmission. That's the one that's the healthcare facility. And then our case rate is 292.28 and hospitalizations are up 7.7%. And that's all I have unless anybody has any questions.
Okay, thanks, Brandy. Okay, presentation, acceptance of financial report. Therese?
Okay, this report is also in your packet. It is through the end of July, and we are 67% into our fiscal year. Ending fund balance is at 7.5 million. Total revenue at 5.7 million, which is 82.2% of budgeted revenue. And total expenditures at 4.5 million, which is 64.7% of budgeted expenditures. Any questions?
Okay. Have a motion to approve the financial report as presented.
Second.
Mark Scranton,
Yes.
Jeff Entler,
Yes.
Candy Clevenger,
Yes.
Carolyn Wagner,
Yes.
Jan Hack.
Yes.
Debbie Hill,
Yes.
Dr. Jerker,
Yes.
Cody Parks,
Yes.
Dr. Smith.
Yes.
Discussion approval of department expenditures. These will be in your packet. Check out your registers. So if anybody's got any questions on the expenses in here.
And then the extension.
Okay. Motion, you make a motion, Candy? Okay. Second? Roll call.
Who seconded,
I
sorry?
did.
Pardon?
I did.
Okay. Mark Scranton,
Yes.
Jeff Entler,
Yes.
Candy Clevenger,
Yes.
Carolyn Wagner,
Yes.
Jan Heck,
Yes.
Debbie Hill,
Yeah.
Dr. Jerger,
Yes.
Cody Parks,
Yes.
Dr. Smith.
Yes.
Okay, do we have any grant applications for review tonight? Okay, I didn't think we did, okay, thanks. And then department division reports, Bethany already gave her presentation on that. The rest of the information from the other departments is in your packet. If anybody's got any questions, staff is here to answer anything individually on their specific departments. I think Rachel's already reviewed some things for us. Kathy, you got anything at all? Marissa?
Karen's also on if you have any questions for her,
Oh, okay.
Director of Lincoln Family Case Management.
Okay. Hearing none, we'll move on to employee recognition. This is back in your packet. We've got several anniversaries this month, so thanks to everybody for their service. Teresa's been here 20 years, Bethany 4 years, Jennifer 4 years, John 2 years, Brandy, not Brandy Binkley, but 1 year, and Jandy 1 year, and Joyce 1 year. So thanks for your efforts, everybody. Yeah. And with that, I'll make a motion that we adjourn.
Randy, do we need a motion?
No, but I jotted it down.
Okay, thank you.
Just as a reminder, if you could leave your closed meeting minutes and we'll shred those. And then we do need Carolyn and Mark to come sign the pre-assessment. And thank you all for coming. And Dr. Smith, hope you enjoyed your first meeting.
Yes.
Hey, they won't all be this short.